verse 25 to 26 po. No? So, in other words, it's very biblical po to be healthy. No? So, it's biblical to be healthy po. No? So, well, this is just my credentials po, just to know, for you to get an idea who I am as a doctor. I'm also board certified as a general internist po. No? That used to be my practice as a doctor when I was still part of the illness medicine practice. But right now, I consider myself as a doctor for health and wellness. No, I make people healthy and well. No, so I took a different training for that as well. Po, that's what we call the functional medicine practice. Po, okay. So those are just my credentials. Let's just pass through that. But I want to focus today, po, on changing your perspective about your health. No, so a lot of people think that when they're not sick, or when they don't have a formal diagnosis of a disease, is that they think that they are healthy. That's not true po, no? So not having any formal disease or not having any symptoms does not indicate to mean that you are equally healthy po, no? Hindi po yun totoo. So because our health po is a continuum, no? A lot of us think that health is a cycle. It's not. It's actually a continuum, no? Ibig sabihin po nito, you have a choice, no? Unlike pag if it's a cycle, no? A lot of people think na pag tumanda na sila is that they're expected to get sick, no? That is not true at all po, no? So since our health is a continuum, no? Even if you're here on the left side, you can actually go back to the right side, no? Achieving a high level of health and wellness, no? Or if you're here already, you can actually just remain there, no? So a lot of people right now are in the neutral point, possibly, and they think that they are healthy, but actually hindi po, no? So as I mentioned, our body po, no? Our body is made up of organs, but our body is made up of, all of these organs are made up of billions of cells po, no? So I think you remember naman your basic science, no? So cell is the basic unit, no, of our body, no? So but these organs, they're not functioning separately or independently. They're actually functioning as one whole, interconnected, interrelated, integrated systems. So this is our body po as a system, no? It's a very complex system. If you can see my slides po, no? So actually may mga words po dyan at saka numbers, but these are what we call our metabolic pathways. This is the ano po, the blueprint of our body, no? This, as I've said, this is an amazing creation by an amazing God, no? So very complex, not just complicated, but a very complex system po ang ating katawan. So that's why if we're going to look at it from an organ perspective, yung hati-hati po ang ating mga doktor, no? Kanya-kanya silang parte ng katawan ninyo. That is going to be perfect if you want to manage your diseases, no? But managing your body po, managing your diseases, require excellent yung organ-based approach. But if you want to manage your health, no? We cannot look at it from an organ perspective, no? We need to look at it from a holistic, integrated, no? Interrelated system as one whole, interconnected, interrelated, and integrated system po. Okay? So this is how I present my practice. Ito po yung mga doktor na kadalasang pinupuntahan ninyo para sa inyong mga karamdaman, no? Yung hinati-hati yung parte ng ating katawan. Pero as I told you po, gawa man po tayo sa pira-pirasong organ, our body is functioning as one whole, interconnected, interrelated system. Actually, 7 po yung sistema ng ating katawan, no? There are 7 systems that makes our body function, no? If it's a system, it is actually it will require balance po, no? So pag may imbalances, may kulang o kaya sobra, pareho pong masama, no? So the system of our body gets imbalanced because of the things here at the bottom of the tree po, no? The things that we do on a day-to-day basis is what will compromise or cause imbalances in our system. So para lang pong kotse yan, para lang pong kotse yan, tulad ng kotse nyo. Ang kotse nyo gawa sa iba't ibang pyesa, but ang sistema ng inyong kotse in order to function will require equally important substrates po, like gasoline, oil, water, battery, the air of the tires, all of it equally important. Pagka kinulang po noon, no, the body as one whole system is the same thing. It will require equally important substrate. We call this the metabolic substrates. Ayan po lahat yon, no? So micronutrients, macronutrients, hormones. Hormones is like the oil of your car, no? Para lang po, dahil yung oil, di ba, pumapasok po siya, nagpe-penetrate siya sa maliliit na pyesa ng inyong ng makina, no? Ganon din po yung hormones, no? They actually enter our cell in order to drive those metabolic pathways na pinakita ko po sa inyo kanina. Just like your car, no? Your body also can have its own rusting or kalawang, no? That's why we need antioxidants, no? We need antioxidants because if you have so much oxidation, parang kotse nyo, kung maliit lang ang kalawang, okay lang. Pero kung masyado pong madaming kalawang, kakainin din niya yung sistema. So these are all equally important substrates that your body needs in order to function as one whole system. Where do you get all of this? The micros and the macros from the food that you are eating. Okay? So this is how I look at the body if I want to manage the health of a person. This is like the matrix of the 7 systems that makes your body function. When I look at your body po, I don't separate the physical from the mental, emotional, and even the spiritual part of our body, no, our health, because they're all interconnected po. The environmental, the social, psychological, physical, and even the spiritual aspect po. Okay? So as I've said, functional medicine is a clinical application of systems biology, no? We look at your body from a network system, no? We don't use much of pathology, pharmacology, and anatomy. We use a lot of biology, physiology, and biochemistry when we try to manage your health. That's why we use food as medicine. We use exercise as medicine. We use nature as medicine. We use sleep as medicine. No? So we don't manage your diseases. We manage and try to address the root causes why you develop, especially those lifestyle and chronic diseases like hypertension, diabetes, heart disease, no? Or even nga itong acute infection po. We try to look at it from a systems perspective, no? So kung nahirapan po kayong i-dissect lahat ng sinabi ko, ito lang po ang ginagawa ko talaga in managing your health. I try to ask these 2 simple questions. So, does this person need to be rid of something toxic, something allergic, something infectious like the COVID-19, no? Or does this person have some unmet individual need required for optimal function, no? So like what we will be talking about this afternoon about the immune system, no? How can you boost your immune system? So the immune system falls under this system called the defense and repair system po, no? So 7 po yung sistema na nagpapatakbo ng inyong katawan o how your body function. One of them is the defense and repair system. But there are other 6 systems po, no? But today I'll focus on the defense and repair, meaning to say about your immune system. Not many doctors po know that 70% of your immune system is actually located in your gut, no? I don't know if you know that as well, but 70% po of your immune system is located in your gut, no? The rest are distributed in your lungs, in your nose, in your mouth, on your skin, on your urinary tract, and on the vaginal tract of a woman, no? So, but 70% po ay nandun sa inyong tiyan, no? To be specific, nandun po sa likuran ng inyong small intestines. So, ito po yung litrato ng wall ng small intestines. Dito po dumadaan yung mga na-digest nyo ng pagkain at yung mga nutrients na laman nun ay papapasukin po dito, sisipsipin ito para pumasok po at nandito po sa likuran ng ating immune system. Okay? So that gut wall, that small intestine is very important po. Ayan, as you can see here. So this is what we call our gut immune system. No? 70% of your immune system is in your gut po. Kung malakas po yan, yan po ay makakasuporta doon sa 30%. Yung immune system niyo nasa lungs, yung immune system niyo na nasa inyong throat, no? Nasa inyong mouth, no? And even on your skin po. No? As you can see here, nasira po yung wall, kaya yan, lumaban na yung immune system po natin. No? So, our immune system, this wall po, no? This wall actually is protected by several, no? Or trillions of microorganisms. We call that the microbiota po. No? That microbiota po is the one that protects the wall and the wall that protects your immune system. So parang ganito po yan. Yan. Okay. If this is the wall that protects your immune system, this wall is protected by these trillions of microorganisms. We call them the microbiota. The microbiota po is made up of good and bad bacteria, good and bad viruses, no? But together, as long as balanse po yung presence ng dalawa, your gut wall will be protected po. If your gut wall is protected, then your immune system is also protected. Okay? So yan po yung mga microbiota natin, no? Ang dami po, no? So trillions po yan, marami pa sa bilang ng cells natin sa katawan, no? At majority sila ay nakatira ho sa ating small intestines at sa ating large intestines. No? So yan, this is another way of looking at the gut wall that protects your immune system. No? So nandito po yung ating mga microbiota. No? So pag nasira po ito, yung gut wall na to, dyan po tayo nagkakaroon ng diarrhea. No? Kaya po tayo nagtatae. Kasi ang pagtatae po is a defensive response of our immune system. Pero pag nailabas na po yung mikrobyo na sumira nitong gut wall ninyo, pwede na po, i-repair na po yan. No? Kaya nga ang tawag sa ating immune system is defense and repair. Okay? So that's why sometimes nakakarinig po kayo ng mga tao na pareho po sila ng kinain, pero yung isa nagtae, sumuka, yung isa okay lang. Kasi depende po yan sa integrity ng gut wall nila at depende rin sa kapal ng kanilang microbiota na nagbabantay sa kanilang gut wall po. Okay, so as I've said, this topic is about your immune system, no? The one that will defend you and repair your body to recover from any type of infection. So very important po for us to talk about this immune system because this is 70% of your immune system. So this is just another, this is what we call the gut-associated lymphoid tissue or the gut immune system. Okay? So kung ang inyo pong gut microbiome ay manipis o kaya meron kayong tinatawag nating gut dysbiosis, mas marami yung bad kaysa sa good bacteria, then this immune system, this gut wall is more prone to damage and more prone to invasion or pag-atake po. Okay? So as I've said, ang ating immune system, 70% ay nasa inyong tiyan, but yung the rest ay nandun po sa inyong ilong, sa bibig, no? Even in your lungs and even on your skin po. Okay? So you have your immune system there as well. Okay? So look at this picture po, no? Tingnan niyo, lahat nagkakasipon, no? The others are susceptible from any infection except for the one in the middle, no? She seems to know something that we don't know. Okay? So because the question po ngayon, oras ng pandemic, no? Is healthy immunity an unmodifiable function of your genes or minalas lang po ba talaga yung ibang na-infect at unfortunately, they also succumb to the COVID-19 infection? Is it by chance lang po talaga, minalas po sila, or can our immunity be modified by the changes in your lifestyle, most especially in your food, because nga 70% of your immune system is in your gut, no? So the answer po is yes. We can modify, we can enhance, we can strengthen, we can boost your immune system. Because sa panahon po ngayon, no, this is the one that makes a difference to several, to each one of us, our susceptibility. No? Of course, kaya nga in-identify po nila yung mga vulnerable, no, yung mga elderly, no, because as we age, our immune system really weakens, no. But even if you're not old and yet you are nutrient deficient, no, or deficit, no, it will also weaken your immune system, and this is where virus can become stronger and virulent. Like for example, these two particular micronutrients, no, selenium and vitamin E. Ang selenium po, no, pag mababa yan sa inyo, it makes the virus more virulent. It gives a more chance for the virus to be able to infect your system. The same way with vitamin E. Genetics, there are also some people who are born with genetic mutations that can impact on the strength of their immune system. Some of them actually don't live po, no? Kung talagang yung genetic mutation ang cause kung bakit mahina ang kanilang immune system. As I've said, yung strength ng inyong immune system, particularly yung 70% of your immune system, which can also be affected by chronic stress. This is what will make you susceptible, or what will make you be able to repel and be able to fight off this particular infection. So there are many ways we can modulate or enhance or suppress or regulate the response of your immune system po. No? So ito po yung titignan natin. Because if you're able to enhance the function of your immune system, you can actually prevent other diseases, not just like this COVID-19 infection. Marami pa pong protection na ginagawa sa inyo ang inyong immune system, especially against several chronic diseases. No? So here are some micronutrients. No? I'm not advocating for you to take supplements. I'm going to be showing you all the sources of foods po, wherein you can get all of these vitamins. No? I'm just pointing out to you po that these vitamins and these micronutrients like the protein, amino acids, no, these are the ones that are needed by your immune system po. Okay, so for vitamin A, yan. So as you can see, it will be able to increase levels of pro-inflammatory cytokines, no? Pagka mababa po ang inyong vitamin A, and then yan, it will predispose you even to weight gain, no? Vitamin A, we get it from carotene, no? So I'll be showing you later on the list of foods, no? But these are just some of the studies that prove that all of these micronutrients is needed by our immune system for it to be healthy, no? So let's begin with vitamin A lang po. But this is the characteristic of a healthy immune system po, no? A healthy immune system should be able to detect and defend you po. No? That's why kita nyo yung mga matatanda, no? Nagkaroon na po sila ng pneumonia, pero hindi naman sila inuubo, hindi naman sila nilalagnat, no? Until nung nahirapan na lang sila na huminga, tapos dinala sa ospital, tapos in x-ray, doon nalaman na meron pala silang pneumonia. No? Because hindi po nakadetect at hindi nakadefend yung kanilang immune system. A healthy immune system should also have internal regulation, no? Internally regulated dapat. Pag tapos na yung trabaho po niya, no? Then dapat mag-repair na po siya, no? But kung walang internal regulation ng inyong immune system, then that is when you see some people po, no? Pareho po kayo ng infection, pareho kayong may pneumonia, pero yung isa after a few days of antibiotics naka-recover, the other one naman nagtuloy-tuloy na ICU, no? Nahirapang huminga, na-intubate and everything. Depende po kasi yon kung may internal regulation ng inyong immune system. And of course, one of the job of the immune system is also to repair you, no? Particularly that gut wall po. But to repair you, as I've said, mangangailangan po kayo ng maraming micronutrients and macronutrients in order to be able to repair your body po, no? So tolerant is another characteristic of our immune system, no? Ito po yung nagkakaproblema doon sa mga taong may autoimmune disease, doon sa mga taong may asthma, or doon sa mga taong may allergic rhinitis po. Nawawala yung tolerance ng kanilang immune system. So that's the characteristic of a healthy immune system. DIRT, no? Detective and defensive, internal regulation, restorative or reparative, and it has tolerance po. So, another micronutrients na kailangan po ng inyong immune system ay vitamin D3. No? So, very, very important. As you can see there, a lot of people think na pagka-winter, kaya madaling magkasipon is dahil sa lamig. Hindi po totoo yun. No? Kaya po nagkakasipon tayo madalas, lalo na sa ibang bansa, yung mga may winter like sa Sweden po, is because of the lack of vitamin D3. Okay? Dalawang klase po ang vitamin D, vitamin D2 and vitamin D3. No? The vitamin D2 is animal source po yan. Vitamin D3 is plant-based sources po. No? So that's the benefit of that. Another study done on vitamin D as a proof that it can really help in the boosting of your immune system, even with regards to the lung immune system. No? How do they work yung vitamin D? Vitamin D produces all of this po. Ito yung tinatawag namin mga peptides, no? Because these peptides has antimicrobial and even anti-allergen properties po yung mga yan. So that can help with the response of your immune system po. So here another study done on influenza naman po, no? So it can help in the production and expression of the different army of cells of your immune system, like the natural killer cells, no? Neutrophils to fight off bacteria. So this is how important vitamin D is, no? Or even for our setting dito sa Pilipinas po, no? Marami tayong may TB dito, no? Because marami pong may kakulangan sa nutrisyon. Vitamin D, which you can get from the sun, can actually have the ability to kill tuberculosis po. Okay? So, you can measure your vitamin D, no? Sa mga ospital na may measure na po yan. 50 to 80 nanograms per ml is the optimal level of vitamin D. So, pag mababa po yan, it will have an effect on the support that it can give to your immune system po. So you can measure that, no? Another thing that is important for your gut immune system is, of course, the probiotics and prebiotics. As I've said kanina po, pinakita ko sa inyo sa litrato, yung ating gut wall na nagbabantay po sa inyong 70% ng inyong immune system is guarded by this live microorganism, no? So these probiotics, marami pong benefit yan. Yan, hindi lamang po sa immune system, to modulate it, no? Even for cancer protection, even for cholesterol, no? So ang dami pong benefit ng probiotics. Where can you get probiotic, or what are probiotic boosting foods? Ito po, fermented foods po, no? That one will help as well. Okay? What happens when you ferment food there? It produces all of this, no? Yung mga bioactive peptides that will give it some antibacterial property, helps you produce enzymes to digest your food, enhances absorption of the vitamins and minerals. No? Napakadami pong benefit nitong mga pagkain na to. An example is kefir. Kefir. No? So those are just some of the historical uses where we used to use this kefir po. Okay? So kimchi is another probiotic boosting foods, no? Very important as well for your immune system, no? Honey, no? Honey is considered to be a symbionts, no? Meaning to say it can be as a probiotics and as a prebiotics as well, no? So if you want to build on right now, pwede na po kayong magluto, no? So you can really create your own probiotic boosting foods and prebiotic foods, no? Pwede na po yan. So para mapakapal po ninyo yung nagdedepensa doon sa 70% of your immune system, and that is your gut wall. Okay? So these are just some of the studies. As you can see here, it was used on elderly patients, no? how elderly patients benefited from probiotics, no? Because it enhances their natural killer cell activity. As I've said, habang tumatanda po, no? Yung pong inyong immune system pwedeng hindi na nakaka-produce ng sapat na kailangan upang ma-maintain ang inyong sistema. Okay, but if you can provide it, no, then you still need not to go straight into having diseases. So probiotics. So this is the summary of all the nutrients that I think it's important for you to be able to boost your immune system. Vitamin A, D, probiotics. Glutamine po is an amino acids which comes from animal sources of protein or even plant-based protein. Pwede rin naman po yan. But these are what is important right now. If you want to boost, enhance, strengthen, at lalong-lalo na kung sigurado kayong mababa po ito sa inyo, no? Then you could actually increase your intake of all of these foods po. I hope you can see the foods, no? Vitamin A, D, E, K. So those are all good sources of all of these different vitamins. You can actually take a screenshot of it if you want po para matandaan po ninyo. So vitamin B naman, B vitamins is also needed by your system, no? So importante po 'yan. Then you can take the photo of this so you can get po yung mga food sources, no? B12, no? And of course even phytochemicals or even vitamin C as an antioxidants. These are all good sources po of food po. If you cannot see it, I can share naman the presentation to Ma'am Helen or to Ma'am sa inyo po para magamit nyo as a grocery list. Okay? So, you also need minerals, hindi lang po vitamins, pati po minerals kailangan nyo rin, no? And mostly you get that from plant-based sources or even from foods coming from the sea, no? Marami pong mga minerals po yan. Okay, so other minerals, calcium. What is important to your immune system is iron, magnesium, and selenium, and zinc, no? Yung zinc po, importante yan sa inyong immune system kasi yan po yung pag nakapasok po yan sa cell ninyo, siya yung magpe-prevent para hindi ma-hijack nung COVID-19 yung pong ating copying machine, no? Yung copying machine natin, yung nasa DNA po natin, yung RNA tsaka DNA. So kasi pag nakapasok po doon yung COVID-19, yun po yung magiging paraan niya para mapadami niya yung bilang niya doon sa inyong katawan. Okay? So, but zinc prevent that particular ability of the COVID-19 to enter our cell and to be able to hijack our copying machine, no? Yung DNA and RNA po natin. Okay? So, prebiotics are mostly coming from plant-based foods, no? Hindi lang po yan maganda sa inyong immune system, even to the other 7 systems, napakadami pong benefit, no? That's why I provide this to my patients, no? Yung tinatawag naming phytonutrient spectrum list. Kasi po, lahat ng pagkaing halaman at ang kanilang mga kulay, iba-iba po ang therapeutic benefits. No? So mas makulay ang inyong pinggan, mas may kulay, no? Mas maraming kulay, mas malaki ang tsansa that you can really protect your immune system po. But for protein, I'm not saying that you become vegetarian, no? But for protein po, there are plant-based sources of protein, lalo na kung kayo ay vegetarian or vegan, no? But there are some protein na talagang mataas lamang po sila sa animal sources. Kaya kung kayo ay vegan, ang isa pinaka-importanting dapat na papalitan ninyo is ang vitamin B12, no? Kasi mababa po lang ang presence niyan sa plant-based sources. Okay? So, you can also use some plant and fungal derived what we call immune modulators like of course kape, no? Huwag lamang po yung instant coffee, yung totoong coffee po talaga, no? Ginger, periwinkle is actually an immune modulator that is used for making the chemotherapy vincristine and vinblastine, no? So these are just some of the material. Another list of plant containing immune modulatory polysaccharides that can help boost and enhance your immune system. Yan po. Aloe vera, andrographis, astragalus. Astragalus actually was used in China po, no? So those who recovered from 80% who recovered from the COVID-19 virus were actually provided with traditional Chinese medicine, and one of them that they use is astragalus po, no? So that's the effect niya, no? It has an immune modulating and increases number of bone marrow stem cells and will enhance maturation of any immune cells po ninyo. So, astragalus, as you can see there, enhances phagocytosis. Yan po yung abilidad ng inyong immune cells na kainin yung mikrobyo, no? To swallow the mikrobyo. So, kung mataas po yan, it can easily kill off yung mga perceived to be an invader of our system. Okay? So, another, astragalus, andrographis, these are just some of herbs and botanicals. Ashwagandha, I have experience for it. This one is not only for your immune system, but even po for mental health. No? Very important po siya. That can, as a substitute. No? So, it has immune modulatory effects. No? Ayan, mobilizes all the cells. Ito mga macrophages po, phagocytosis, lahat po yan, army of cells ng ating immune system. That's how our immune system is able to protect us. No? So, echinacea, naku, napakadami po niyan sa Pilipinas. No? There are in vitro and in vivo studies po niyan that can help, no? All of this. These are all function of your immune system. Yung nakikita nyo sa screen niyo, no? So it can enhance, no? Especially for in vitro studies, no? This one will also help in boosting your immune system. So other immune modulatory polysaccharides, yan pa ho yung iba, ginseng, eleuterio, or what we call Siberian ginseng, no? So, yung iba dyan, baka wala po tayo, pero halos lahat meron naman po tayo. So, yan yung isa pang herb po. We call it Siberian ginseng po. So, used for prevention and treatment of colds and flus, no? So, ito po yung mga pwede nyong magamit po, and the dosage requirement po nila. Licorice root, ito hindi to basta-basta ginagamit po unless you are supervised by a doctor, But as far as meron yung studies done on its antiviral property even dun sa SARS po, no, noong 2009, no, ginamit po siya. And then influenza, of course, no, plus yung other viruses po. Okay? So mushrooms is also another, because of this content, we call it beta glucans, no? As you can see yan, it will increase resistance to virus, viral, bacterial, protozoan, and fungal diseases. Promotes wound healing, increases mucosal immunity, no? The one that's producing antibodies against a particular virus, no? So this is the summary of all of these immune modulators po, no? Para you can boost and strengthen and enhance your immune system. A little disclaimer lang on the licorice kasi kailangan po ng guidance ng doktor niya. Okay? So other things that you can use, yung mga glutathione enhancers. Glutathione po is an antioxidant. No? Antioxidant because as I've said, pag marami pong oxidation sa inyong sistema, there will be what we call oxidative stress or elevation of oxidative stress, which will also impact on how your immune system can function. So there, those are what was used before, yung N-acetylcysteine. N-acetylcysteine po is an amino acids, no, that will become glutathione once ma-metabolize po siya ng inyong katawan. Okay, so N-acetylcysteine. So antioxidants is important coming from here, no? Sulforaphane, galing po yan sa mga cruciferous vegetables like broccoli, spinach, no? What else? Yung mga mabeberdeng dahon at gulay po, all contains sulforaphane. Curcumin and ginger is of course from luyang dilaw. Transresveratrol is from grapes. Quercetin is from sibuyas, from apples, no? Plus all berries, mayaman po yan sa quercetin. Quercetin has an antihistamine effect, no? Nang hindi po nakakaantok, no? Plus the others, you can find that mostly on plant-based sources po. So, Some bioactive proteins like yung colostrum, of course, galing po yan sa breast milk, no, yung colostrum. That can also boost and enhance the function of our immune system. That's why magkaiba po ang immune system ng batang pinanganak ng cesarean na, tapos bottle fed pa, versus the ones na natural born at the same time breastfed po. It definitely is getting benefit from colostrum. You can also use some immune modulators in the form of fatty acids po, like the fish oil, the omega-3 fatty acids, the omega-6 fatty acids, the omega-9 fatty acids. All of this can help your immune system response po. So for preventing respiratory infection, these are some of what I use in my practice, no? In that specific dosages po, no? Lalo na kung meron akong ability na pwede ko pong sukatin yung mga micronutrient levels ng tao na yon, then I can give as much as dose depende sa pangangailangan po ng pasyente. So supplements for treating infection, no? Vitamin D, C, licorice root, no? So iba dyan meron naman sa atin po. Okay, tapos na po tayo sa food, no? So using food as medicine. Now let's use exercise as your medicine, no? As I mentioned, exercise, if done so much po, can actually weaken your immune system. It will damage your gut wall, causing for you to predispose for you to have an immune system response po, no? Kaya kita nyo yung mga athletes, no? Pagka masyadong intense at saka prolong yung kanilang training, no? They can suffer from recurring infection po. So this is one mechanism why exercise, if done too much, no, pag sobra-sobra po, can actually lower down your glutamine, no? Yung glutamine, yun po yung pang-repair ninyo sa gut wall immune system nyo. Siya yung hollow blocks para makagawa ng yung gut wall natin ng wall, no, para ma-repair niya yung gut wall. So importante po yung glutamine po, no? Of course, exercise, if done properly as well, can also produce what we call endorphins, no? Which will enhance your mood, lalo na kung kayo po yung nagsasuffer ngayon sa depression, sa anxiety, sa panic attacks, no? This one will produce endorphins as well as improve your sleep po. Okay? So kung sapat ang inyong pagtulog, no, optimal, doon po nangyayari sa tulog natin yung 7 physiologic systems, doon po sila nagtatrabaho ng gusto during our sleep, no? In order for us to be provided ng mga materials para lumaban po doon sa ating mga perceived to be danger ng ating sistema, ng ating katawan. Okay? So, exercise is not only good for your immune system, it has been shown to reduce all of these conditions and diseases, no? So, more reason for you to exercise po. Exercise can also make a difference on the mental, emotional, and even on the spiritual part of your body, no? As you can see here, pag kayo po ay nag-exercise regularly, it can increase the size of the hippocampus, which is where the memory center is located. Then, it will be able to enhance your memory rin po, no? Emotional, spiritual, these are some of the benefits of exercise po. So defense and repair, as I've said, this is the system kung saan nandun po ang inyong immune system. So exercise can actually, again, increase natural killer cell activity din. So very important po, no? So right now you're on a lockdown. Maybe you don't have the time to go to the gym. You can follow all of this, some home and office exercises that you can do. This is an example po of an exercise prescription that I give to my patient, no? So kasi ang exercise po, pine-personalize din po siya, no? So hindi po yung one size fits all din. So everything can be designed for you, no? So or if you don't have the time to the gym at ayaw niyo po talagang lumabas, yan, you can consider all of these free technologies, no? In order to provide yourself with the value and benefit of having a regular exercise. So these are just some of the phone apps. Many of them are free lang po, no? Libre lang po siya. Yan pa iba. Fitness Blender, Sweaty Betty, Spark People, if you're into yoga or if you're into Pilates, no? As I've said, this is now the best time to care for yourself because you have all the time to exercise po, aside from making use of food as medicine. So sleep naman po, no? So ito yung tatlong kailangan ng ating sistema, ng ating immune system. So maraming doktor hindi alam itong mga ito patungkol sa ating pagtulog, no? Especially yung last part, sleep loss equals weight gain, no? So but how much sleep do you need, no? So hindi po totoo na pag tumatanda tayo, expected natin iikli ang ating pagtulog. Hindi po, no? Pero may dahilan kung bakit umiikli po 'yon. At pero pwede pa po nating ma-improve po 'yon because even though you are an adult or baby boomers, no, you need to be able to get at least 7 hours of therapeutic sleep po or 7 hours of required daily sleep po natin. Okay? Teenagers actually need more, no, about up to 9 hours. Okay? Because if your sleep deficit po, no, these are all the consequences of sleep deficiency. No? So not only for your immune system, but for your mental health, no? For your safety, ang dami-dami po. No? So what regulates our sleep are these three substances po, these three chemicals, adenosine, melatonin, and cortisol. No? Yung adenosine, yan po yung naapektuhan ng kape. No? Lalo na kung kayo ay umiinom pa ng kape, even after 12 o'clock, no? That will stop the build-up of this adenosine, which later on, if you want to sleep na, hindi na po kayo makatulog. Melatonin, of course, this is the one that gets reduced as we age, no? But you can still replace it, no? As long as you know how much to give, no? Cortisol is our stress hormone. Ito po yung ginagamit natin para maka-cope up tayo sa stressors natin ngayon. But if this is out of whack, no, you're producing a lot of it because of your chronic stress, that will definitely trigger different conditions and diseases kung magpapatuloy po yan. So tayo po ay nabibilang sa top 5 worst countries with the shortest sleep po, no, 6 hours and 20 minutes apparently, no. So napakababa ng ating ranking. So sleep is required for numerous biochemical reactions in the body. As I've said po, lahat nung pinakita ko sa inyo kaninang biochemical pathway na napaka-komplikado, most of it is actually happening during our sleep, no? Kung kailan umaandar po 'yon. So kung may problema po doon, then sooner or later, your sleep deprivation will lead to different conditions or different diseases. So as I've your
Doc?
and increase susceptibility to infection. Po. Hello? Hello? Hello?
Yes, Doc.
Almost done na po. Almost done na. Almost done na. Can you still hear me po?
Yes.
Okay. So, the key lang is how do you create balance about all of this, no? Sleep, fitness and movement or exercise, and then yung pong restoration and movement, no? And of course, your nutrition. These are important biological factors that will restore, optimize, enhance your body as a system or how the systems of your body will function. So that's the motto po of IFM, no, the organization where I belong, no, the Institute for Functional Medicine. We changing the way we do medicine and the medicine we do, no. So I started my talk with the Word of God. I will end it as well, din po, with the Word of God, no. So true wisdom and real power belong to God. From Him we learn how to live and also what to live for. That is in Job chapter 12, verse 13 po. So if you're ready na to start your wellness journey, I think this is the perfect time for you to look at yourself and do self-care. No? This is now the time that you can really look at your nutrition. Are you able to exercise? And are you getting adequate sleep po? No? So thank you very much. I hope I get to teach you and make you learn something this afternoon po about our human body, no? About our immune system especially, no? Not only about the virus, no? That virus will be taken care of po by quarantine and lockdown. But if in case hindi nyo maiwasan talaga dahil ang virus ay all over our place, no? It's your immune system that you need to work on in order to lessen or your susceptibility for the virus to manifest sa inyo po, no? So or by enhancing and boosting your immune system. So if you have any questions po, Ma'am Jack, I'll be happy to answer.
Oh yeah.
Doc, thank you very much for giving us a afternoon.
Ano ulitin? Salamat.
Hello?
Not as questions, please mute your...
Yeah, if you have questions po, I'll be happy to answer.
Yeah. So anybody who wants to ask a question kay Doc, can you please unmute your... or raise your hand.
Any questions po?
Yes.
Yes po. Yes.
Hi, Doc. Good afternoon. I have a question po.
Yes.
For you mentioned earlier kefir kasi I had stomach CA stage 1A pero almost 10 years na po ako today. This year na palang survivor. So what I do, meron akong nakuhang grains for water kefir. So fini-ferment po. Ilan po ang pwedeng i-take? Ilang baso siguro to prevent, lalo na sa time na ganito na iniiwasan makakuha ng virus?
Well, wala namang toxicity dyan, no? So, as long as, remember, ang goal po why you're drinking kefir, kefir is a probiotic boosting foods, no? What it will do is that when the microorganism that accompanies this kefir is able to enter your body, it will be able to release, no, chemicals that will help growth of the good bacteria that are already inside your gut. No? So the more you feed them, as I've said, the value of the microbiome is dependent on its diversity, richness, and thickness. No? So the more that we're able to feed this microorganism, our microbiome, no, the healthier you are. No? So remember, as I've said, 70% of your immune system is behind the wall of your small intestines. Alam mo, Chriselle, yung small intestines natin, pag tinanggal natin yan sa katawan natin at in-spread out mo siya, it can actually occupy half of a tennis court. Ganon siya kalawak, yung small intestines. No? Kasi ang trabaho niya is to assimilate nutrients from all the food that we are eating. No? Kaya pag in-expand mo yung small intestines, para makuha mo yung body, yung surface area niya, it can actually occupy half of a tennis court. Ganon siya kalawak. So, ganon din kalawak yung pinoprotektahan niyang gut immune system natin. 70%. Okay?
Thank you.
Oh, thank you.
Yes,
thank you for your question. Sige. Any more question po?
Hi, Doc. Good afternoon.
Yes, good afternoon.
This is Paul. Thank you for a lot of information. Very timely and very helpful for us. And also, Mami Jackie, thank you. Very for initiating it. Doc, I have a question lang. Kanina, you talked about selenium and vitamin E and zinc.
Yep.
And, I'd like to know how much of those should we be taking to give us, the maximum protection and benefit, like an overdose or.
Ang vitamin D, there is such a thing as toxicity niyan, ha? So, but you can get as much as like 4,000 to 5,000 IU per day. That's okay. It will also be good if you're able to measure it. Kahit saan namang ospital, pwede yung ipa-measure. Pero wag muna kayo pupunta ng ospital, ha? So, hindi muna kayo ipa-measure. But normally lang, you know that your vitamin D is too much already if you're experiencing muscle cramps. Kasi one of the effect of too much vitamin D is that babagsak naman ang iyong magnesium. No? Ang magnesium mo babagsak, and then you'll notice that you're prone to cramps or your muscle cramps, or you're going to have muscle aches even. No? So alam mo na sobra na siya. Pero as a maintenance, actually 2,000 IU is good as a maintenance dose for vitamin D. You can get that actually from exposing yourself to the sun, no? 7 a.m. to 9 a.m. Kung medyo maputi ka, siguro pwede ng 30 minutes. Kung medyo maitim ka, mas matagal-tagal, no? At saka talagang dapat naka-expose para for you to get the adequate dose of your vitamin D, no? So selenium, well, you can get as much as like, ang dose lang naman yan, binibenta lang talaga niyan is at about 200 microgram, no? Ang dosages preparation yan. But you can get selenium or any minerals from the produce from the sea, no? Or selenium is also very high in brown rice, no? You can get that from there. But yung mga, kasi ako gumagamit ako sa practice ko, Paul, ng yung professional brands of micronutrients, no? Normally there are dosages preparation yan about amounting to 200 microgram, no? Yung zinc, you can get as much as like 50 milligrams per day. That's gonna be okay, no? Zinc and selenium mostly are contained in any multi-mineral formulation, no? Wag lang lalagpas masyadong mataas ang zinc at 50 milligrams because babagsak naman ang iyong copper, no? So pagka sobra naman ng zinc, no, mapapansin mo, lalo na kung bata ka pa, bigla kang magkakaroon ng premature graying of hair. Ibig sabihin niyan, may copper deficiency ka na. Kung below 35 years old, biglang nagkaputi ka ng buhok, that's indication of copper deficiency. Baka naman nasusobrahan ka sa zinc kaya bumabagsak ang iyong copper. So ganun kasi ang ating katawan. Lahat ay konektado. Okay? So did I answer your question?
Yes, no, thank you.
Yes.
And
So,
I just have one more.
Sure.
Okay. Regarding COVID-19, and also like, some cancer cells. Kasi I read some articles that says that, COVID virus and the cancer cells as well, they have the capacity to cloak themselves from the immune system.
Mm-hmm.
So having said that, hindi sila nakikita ng immune system. That's why nakakapasok sila dun sa system natin.
Mm-hmm.
Without
Yep.
the immune system noticing it.
Yep.
So how can we, how can that be prevented? Kasi di ba, the immune system will fight kung nakikita nila. But what if they don't see it?
That's the main reason why you need to provide all the necessary substrates that our immune system needs, no? In order for them to manifest yung sinasabi ko kaninang characteristic nila, yung DIRT, di ba? Detect and defend, internal regulation, restoration, at saka tolerance, no? But one of the things that can help is vitamin C talaga, no? So vitamin C kasi, ang role ng vitamin C, number one, if you get infected with COVID-19 or any viral infection, no, our vitamin C gets depleted. Okay, so vitamin C is considered to be an antioxidant. So when your vitamin C gets depleted, no, it will not be able, your immune cells will not be able to identify the infected cells. That's how they cloak themselves. Yung sinasabi mo kanina, that's how they are able to prevent the immune cells from identifying them. No? So if you're lacking in vitamin C, that's why your immune cells is having difficulty identifying which one are invaders and which one are your normal cells. The same way with cancer cells. That's why nga, lumabas yang sa internet few days ago about the high-dose vitamin C apparently that the Chinese are doing, yung intravenous IV vitamin C at 24,000 milligrams, no? IV pa siya. That needs to be verified, but possibly that is true as well. But it's not only the vitamin C that made that possible why those people recovered from the COVID-19. I'm pretty sure there are several substrates as well provided, no, to the system, but they just made sure that the vitamin C is super optimal so that its main function of trying to identify infected cells, no, Meron tayo kasi isang cell natin, Paul, ito tawag nating interferons. No? The interferons are the ones identifying which one of your cells are infected by this virus. And this is enhanced by the vitamin C. Or if you don't have the vitamin C, this particular function is not happening. Okay, so you can. I'm not advocating for people to load them up with supplements. No, but personally, I do it to myself. No, I do it to my family. But that's why you see, I've shown you the list of foods that contains all of those micronutrients. Because kung mag-aamin ka sa sarili mo na talagang yung mga kinakain mo ngayon ay wala naman talagang laman ng mga ganong micronutrients, no? I can see Ma'am Helen now on the screen. Then it's about time now that you change nga the quality and the quantity of the foods that you're eating, no? So kasi kung bago nag-pandemic, kung ano yung kalidad ng iyong nutrisyon at masasabi mo sa sarili mo na, naku, hindi ako nag-load up nito mga ito sa mga klase ng kinakain ko before, most likely you are deficient. Maybe that is a good gauge for you to be able to, change your food intake right now. Or if you don't mind loading up with nutraceuticals, then that's okay also. You just have to be careful with the kind of brands that you're using. Make sure that the quality, potency, and purity is guaranteed, no? Or better yet, if you're able to be guided by a doctor as well.
Okay. Thank you, Doc. By the way, I'm an advocate of what you are saying. Vegetarian po ako.
Good. No,
Yeah.
so then you have no problem with micronutrients. I'm kind of certain with that. No, so you get all of these micronutrients from all the plant-based sources that you're eating. Just make sure lang that you load up on your vitamin B12, because oftentimes vegetarians are deficient on vitamin B12. No, so because high sources of vitamin B12 are only common lang on animal sources, but you can still get it from plant-based sources, but maybe not enough. So this is probably one nutraceuticals that you should be loading up as well, because B12 is also important for the system. You are good. That's good.
I'm taking the B12 din po. Thank you, Doc.
That's
very
good.
much
That's good.
Appreciated po. Salamat po.
Okay, thank you. Thank you. Any more questions po? Ma'am Helen, kayo, wala pa kayong questions? How are you doing? Ma'am Helen.
Yes. Hello, Doc. Can you hear me?
I can hear you.
Yeah, I don't have any question, but I just want to show my appreciation and how you want to support our group, and to Ma'am Jackie to making this possible for the members, because at this time when COVID really attacked us, I've been telling everyone it's our unseen enemy, and our big defense is to increase or boost our immune system. That's how we can fight, being attacked by this unseen enemy. And also, I want to tell the group that I'm a living example of Dr. Oyi's advocacy. Maybe I got well without, applying the traditional, what they call the conventional Western medicine, Western treatment. But I believe in his cause, I believe in his advocacy, and I believe that food is really our medicine. And it's time for us to have this culture to shift to this kind of method of maintaining our wellness. And I have a request, Dr. Oyi, baka pwede tayo mag-second part, ano? Ang second part natin, kung pwede, how to maintain youthful complexion, kasi kanina ko pa kayo tinititigan, napakakinis. Youthful looking. Well, lahat kami gusto ng ganyan.
Well, kailangan ko po mag-benefit naman sa aking practice po, kasi of course I have to walk the talk. I have to practice what I preach, no. But thank you rin po, no. So salamat din, of course, very much appreciated po. Sure, ito po ay aking advocacy. Tulad ng sabi ko, ito na lang po ang aking maitutulong doon sa aking mga colleagues na nasa frontliners po. No? So, sabi ko nga, kung kayo po ay mananatiling malusog, yung mga tao sa bahay-bahay nila, kung mananatili po kayong malusog, wala po kayong dahilan para pumunta sa ospital. No? At hindi po kayo makakadagdag sa burden ng ating mga frontliners. No? Pagka na-unload natin ang ating mga frontliners po, kahit pa paano, they can also take care of themselves po. No? Kasi kawawa naman sila. Puyat na, pagod pa, hindi pa kumakain po yung mga yan. No? Hanggat may pasyenteng iba dyan, hindi kumakain po yan. Dahil yung energy nila is driven by the cortisol nila. No? So that's why, sana ho, itong ganitong mga pag-uusap maka-contribute para makagawa naman po tayo ng kakaibang klaseng epidemic. No? We can create an epidemic of healthy people. I think mas maganda po yun. No? So rather than we can have a pandemic of healthy people. So kayo po yun, yung mga taong nasa inyong kanya-kanyang bahay, no? Kahit meron kayong chronic diseases, kung wala po kayong dahilan para pumunta sa emergency room, then you get to help then po to unload the burden and the difficulties na hinaharap ngayon ng ating mga frontliners. That's why I offer this for free. If you want a second time, third time, it's okay po. I'm just here at home. No? So, meron pa ho tayong 2 linggong pagsasama-sama. So, I can provide the information sa inyo po. Every day, I share different ways on how to do self-care, Ma'am Helen. No? So, sabi ko nga po kanina, sabi ng aking mentor, si Dr. Jim Gordon, self-care is the heart of self-care, the heart of all healthcare. No? Self-care is the heart of all healthcare. No? Ang inyo pong kalusugan ay hindi gagawin, hindi malilikha sa ospital or sa klinika ng inyong doktor. Yan po ay magsisimula sa inyong kusina. No? How you make your kitchen as your pharmacy. Pharmacy, F-A-R-M-A-C-Y. No? So yan po yung nakalagay sa aking clinic. Di ba, Ma'am Helen? Natatandaan nyo? Make food as your medicine, your kitchen as your pharmacy, and your lifestyle as your own personal physician. Okay? So, at the end of the day po, kayo
Beautiful.
ang
It's
manager
beautiful.
when it comes to your health po. Kayo ang manage your health. Not your doctor, not the hospital, but kayo po. Okay? Yung diseases nyo, sila ang the best to manage. But kayo po, there is a science and practice about health and wellness medicine po. And this is the science behind it. It's called functional medicine. Okay? Thank you po. No? If you have any more questions, I have the time in the world na you can shoot it po. So, my next webinar is at 4 o'clock pa naman. So I still have a lot of time to answer your questions for those who have joined us. No? Mahiyain yung iba ata, ayaw magtanong. No?
Doc, si Miss Jackie may question ata, Doc.
Yes, Miss Jackie.
Like to thank Doc for his afternoon. Very enlightening.
You're welcome po.
After the COVID, is there a way for us to know what we need is there a machine that can measure kung saan ako nagkukulang ng mineral, ng vitamin?
Yes, there is na po. It's actually even available in some big hospitals like Medical City or Makati Med, no? Or I think even St. Luke's, no? It's actually, there's one laboratory, it's called Metametrics Laboratory. You know who owns this laboratory? It's actually owned by Unilab, no? The biggest pharmaceutical company in the Philippines is now investing in health and wellness medicine, no? Metametrics Lab, and the laboratory tests, they can measure your vitamins, your minerals, your fatty acids, your amino acids. No, you can Google them. Metametrics Lab, the very first nutrient testing lab in the country. They opened in July 2018. And I would do a disclaimer. I'm actually the consultant director there po. No, so I'm a consultant director of that laboratory, and I'm the one who gives talk for them. No. But you can measure po, no? Maganda. Tulad ng sabi ko po kasi, Ma'am Jackie, bawat isa po sa atin, meron tayong tinatawag na biochemical individuality, no? Ibig sabihin po nun, maaring si Ma'am Helen, she needs 5,000 milligrams of vitamin C, kayo you only need 2,000 milligrams of vitamin C. So iba-iba po tayo, no? So that's why it's good to measure, no? Kaya nga po itong tawag sa practice namin, it's called measured wellness or scientific wellness, no? So pwede pong sukatin kung gugustuhin ninyo. Baka mamaya ito pala ang dahilan, yung nutrient deficiencies ninyo, kung bakit kayo merong mga chronic diseases. Like for example, hypertension. Alam niyo po ba na ang hypertension is not a disease? Hypertension is a sign that you have a lot of micronutrient deficit and macronutrient deficit, no? Kasi di ba ho, ang blood pressure ninyo, ito po ay reflection ng presyon sa loob ng inyong blood vessel, right? No? So ang ating blood vessel, pag ito po ay healthy, ito po ay parang rubber band. Bubuka, sasara. Pag malamig, bubuka para dumami ang blood flow, para tumaas ang body temperature ninyo, para hindi kayo ginawin, right? So tapos pag kayo naman nagalit kayo, galit na galit kayo, no? Dapat sasara siya, no? Para protektahan po yung inyong blood vessel. So ganun po ang healthy blood vessel. Pwedeng bumuka, pwedeng sumara. Ngayon, pag kulang-kulang ng substrates po ang inyong blood vessel na kailangan niya para maging healthy siya, that is the time that you're going to manifest with elevated blood pressure. No? So because matigas na po siya, makunat siya, no? So makunat siya, hindi siya bubuka, makipot siya, then tataas ang resistance sa loob ng blood vessel ninyo. Pag mataas ang resistance, tataas ang pressure, no? So ano po yung mga nutrients na kailangan nyo kung kayo ay nagmamanifest ng hypertension para ma-reverse ninyo ang inyong hypertension? Number 1 dyan, magnesium, no? Pag kayo ay deficient of magnesium dahil hindi kayo mahilig kumain ng mga mabeberding gulay at madadahong gulay, your blood pressure will go up, no? Tataas din po ang inyong presyon kung kayo ay may deficiency sa vitamin D din, vitamin D, no? O kaya pag deficient din po kayo sa tinatawag nating amino acids na protina, tawag natin arginine, no? Yung arginine po, isang amino acid, pag mababa yan sa inyo, tataas din ang inyong presyon, no? O kaya kung kayo ay deficient ng isang napaka-importanting fatty acid, no? Yung tinatawag nating omega-3 fatty acids or fish oil, your blood pressure will also go up, no? Or if you are deficient of what we call an antioxidant na tinatawag nating ubiquinol or CoQ10, your blood pressure will also go up po. So kung kayo po ay may high blood at hindi nyo alam ang root cause bakit kayo may high blood, lahat pala ito ay present sa inyo. At ang alam nyo lang gawin sa high blood ninyo ay uminom ng pampababa ng blood pressure, no? Then you'll be maintaining your antihypertensive medication, no? But actually, the problem is not the pressure. The problem is the reflection of the manifestation. Your blood pressure is the manifestation of the true problem, and the true problem is your blood vessel is not healthy because you are lacking those micronutrients, no? So kung papalitan nyo na po yung kakulangan, mapapansin niyo bababa na ho ng kusa ang inyong blood pressure. Na every time na uminom kayo ng antihypertensive medication nyo, sobrang bumababa na siya ng husto, no? That will be the signal na kailangan nyo nang bumalik sa inyong doktor para siya na ho ang mag-discontinue ng inyong antihypertensive medication kasi hindi nyo na kailangan. So pagka ganon, ibig sabihin, na-reverse nyo na po ang inyong hypertension. Okay? So ganun po yun, Ma'am Jackie. Okay? So
I can take magnesium, vitamin D, well, okay, and fish oil, COQ.
well, you can. Wala namang masama po dyan. But as I've said, maganda pa rin kung ipasukat ninyo later on after the pandemic kasi minsan po, as I've said, iba-iba po ang dosages requirement natin, no? Kasi kung magre-rely kayo doon sa commercial formulation, halimbawa yung mga multivitamins and multiminerals na commercial formulation, yung po kasing dosages noon, binase lang yon sa assumption na lahat po tayo 70 kilograms. Lahat tayo pare-pareho, no? Pero hindi naman po tayo pare-pareho, iba-iba po tayo, no? So, maganda pa rin na sukatin po ang inyong nutrient levels para malaman nyo kung ano ang deficient sa inyo at ilan ang kailangan ninyo. No? So kasi nga po meron tayong tinatawag na biochemical individuality po. No? Iba-iba po tayo. No? So, halimbawa ako, maaring kailangan ko 10,000 IU of vitamin D. Kayo, possibly, kailangan nyo 2,000 IU lang. No? So, iba-iba po kasi tayo. Okay? So, any more questions po?
Anybody else want?
Anybody else? Okay. You have to turn on your microphone po para marinig natin ang inyong tanong. Okay. Any more questions? I can see we have 27. He's my daughter. So 27 participants. Are these participants? 35 participants. No? So hello, that's my daughter po, si Bri. So they're doing soccer with their kuya, no? Or they're doing training ng soccer. So so any question? Yes po.
Questions? May narinig ko.
Question.
Yes po.
Hello po.
Yes,
Yes,
ma'am.
good afternoon po, Doc. Question lang po. If you are experiencing, say, LBM, what's the best remedy? Maganda po bang i-allow lang na ma-release yung toxins or iinuman po ng like mga diet tabs, ganon?
Question. Tama yan. Yeah. Good question. Well, as I've said kanina, ang diarrhea is a manifestation of the defense mechanism of our body. One thing lang that you need to avoid with diarrhea is that you don't get dehydrated because when you're losing a lot of fluids, you're not only losing fluids, you're also losing minerals, no, or electrolytes, no, like sodium, potassium, no. So kailangan lang palitan siya, no? But taking diatabs, no, you're actually aggravating the problem because, as I've said, the goal of your gut immune system is to palabasin yung toxins, no, na nakapasok at naka-invade ng iyong gut wall, no. So pagka pinigil mo yon, then you're retaining the toxins as well that this particular harmful microorganism can produce, no. And that's why some people namimilipit, sumasakit ang tiyan nila, no. So hayaan lang natin, ang importante lang diyan, alam mo yung senyales kung ikaw ay nagkakaroon na ng dehydration, kasi lalo na pag na-dehydrate ka, yung iyong sodium babagsak. Pag bumagsak ang iyong sodium, masusuka ka. Pag nasusuka ka, hindi ka na makakapag-replace ng volume losses mo. O pagka ganon, dapat ka na talagang pumunta sa ospital para mapalitan natin ng fluids mo using IV solution. No? So, pero kung kaya mo namang palitan, then okay lang, hayaan lang natin ng diarrhea. No? It's a defense mechanism of our body. Okay?
Alright po. Thank you po, Doc. God bless po. Thank
God
you.
bless po. Thank you. So, any more questions po? Any more questions?
Hello, Doc. Hello.
Yes. Oh, yes. Joma. Yes.
Yeah, hi.
Yeah, hi.
Doc, tatanong ko lang po, with the people who are under medication of antiretrovirals, will that help prevent yung nCoV, or ano lang yun, parang they're still placed under the category ng along with those who are impaired?
Experimental, you mean?
I'll repeat that. I'll try to rephrase the question.
Sige.
Para mas, for people who are under medication of antiretrovirals, are they at higher risk to exposure to the nCoV, or are the antiretrovirals that they are taking already helping them in having preventive infection or prevented yung infection ng nCoV sa kanila?
Okay. So meron talagang mga conditions that require an antiviral treatment, no? So but remember, each viruses are different kasi, no? Ang ability ng virus in order to damage or enter our cell wall is dependent if the virus has the receptor, no? Parang if they have the key to enter your house, no? So meron tayong tinatawag sa surface ng ating cell wall, meron tayong tinatawag na receptor, no? So parang yung doorknob ng ating bahay. So ang mga viruses, they're able to enter your house kung may susi sila. So that's the receptor nga. So but each viruses have different ability or have different receptor design. No? So depende yon. So even if you're taking antiviral treatment, and yet that antiviral treatment was studied to just be able to address the specific receptor of a specific virus, that is the only one that is where it is going to be effective lang. So wala talagang hindi siya magkakaroon ng benefit doon sa, lalo nga kaya nga tinawag nating novel virus itong coronavirus, is because wala pa talaga tayong known treatment, no? So ngayon yung lumabas yung recent, yung chloroquine tsaka azithromycin, no, na merong anecdotal evidence, but it's too early to say talaga whether this is going to help, at saka kung ito ba iinumin as, definitely I think it's worth trying it for those people who are already on the latter stage of the COVID-19 infection, yung talaga nagkaroon na sila ng ARDS or acute respiratory distress syndrome. It's worth trying that particular protocol, but not as a prophylaxis. No? For the antiviral treatment, I know there are some antiviral treatment available there. No? Even sometimes this is used for, some of it as dual purpose, even used for cancer patients, no? Or for autoimmune disease patients. But the coronavirus, as of present time, wala pa talagang known that can really, the only defense that we can do is prevent it, no, from multiplying, or better yet, if you can prevent it from being able to enter our cell, no, that's the best way. That's why you see this virus have a lot of people that are asymptomatic. No, they're asymptomatic. They're carriers. They got infected already, and yet they're asymptomatic. That means to say their immune system of that person is working, you know, working against this virus to be able for it not to replicate. So yung isang nakikitang beneficial na minerals dyan is the zinc, no? Because the virus, the coronavirus, they have a predisposition towards going to the lungs, no? Kaya pupunta muna yan sa throat, no? And then once they're able to enter the cell of the lungs, no, they can actually go direct to our nucleus, and in our nucleus nandun yung ating DNA, di ba? Tsaka yung RNA, sila yung copying machine natin. So pag na-hijack na yan ng COVID-19 virus, yun na yun. That's the ability of the virus now to be able to replicate, no? To increase in number. Okay, then downhill na yan pagka ganyan. That's why our best chance is really to strengthen our immune system so that we don't allow this virus to be able to enter our system. And if they will not be able to enter, and especially if our immune system is able to recognize them, then our immune system will be able to prevent them from growing and from increasing in number. So that's the best but right now, even if you're on antiviral, in fact, you are going to be considered as a vulnerable patient if you are on an antiviral treatment as well. Okay? Did I answer your question,
Doc, thanks.
Dima? Did I answer it? Hello? Okay. Sige. Any more questions?
Debbie, do you have a question? Hello, Debbie.
Hello? So any more questions po?
Anyone else?
Me, Doc, I have a question.
Yes po. Miss Karen.
Yeah. Wait, show my... Hi. Yeah, Doc, I have vitamin D3 kasi, di ba, we don't get enough sunlight, lalo na ngayong we're lockdown. How much should we take?
Maintenance, at least there's nothing if you're going to take about 2,000 IU of that per day. No?
This is 5,000 IU.
Ano na? 5,000. It's fine. You can take it once a day na lang. Once a day, or if you once a day, that's still fine. Just observe lang if after taking it and then later on you start noticing that you're having muscle cramps, you probably be needing magnesium as well. No? Kasi one of the effect of a high dose vitamin D, as I've said kanina, is that it will bring down your magnesium level. And magnesium is very important to your muscles kasi. So, pagka ganyan, you may need to supplement also with a mineral magnesium kung mababa ang iyong magnesium. Okay?
All right.
But 5,000 is fine, especially for someone who's now on a lockdown, no? So, in a lockdown. So, that's fine lang. No? So you can
Okay. I have 5,000 kasi this was prescribed before when we were in training kasi.
Okay, you can take that once a day is okay. Just make sure you take that in the morning, not at night time. In the morning, you
Oh,
yeah,
okay.
daytime siya. Yes, para magamit ng sistema ng katawan mo. So,
Okay.
daytime siya.
Thank you for that.
Okay, sige. Thank you also.
You.
Okay. Any more questions po? I hope you're learning more about our immune system. And you can also brag about it, just like how much others are bragging about the virus. No? But we have the half of the equation po. The half of this situation is our immune system. Kaya pinapakilala ko lamang po siya sa inyo. Magaling po yung lumikha sa atin. It's an amazing creation. We just have to support and help it po. Okay? So any questions po? Meron pa?
Hello, Doc.
Yes po.
Hello, Doc.
Yes.
Ay, Debbie? Sige, ikaw na.
Sige.
This is
Hello,
Debbie.
Doc. Hello po, Debbie po.
Yes, Ma'am Debbie. Yes po.
From Ireland.
From Ireland pa. Okay. So, yes.
So, may question lang ako, Doc, with regards to melatonin, especially for elder population. Kasi yung lola ko is having insomnia nga before of old age din. And I think it's affecting her immune system in general. Kasi she's parang siguro 2 to 3 to 4 hours max yung tulog niya. Are you advising for them to take extra supplement of melatonin for elder population po?
Yes. Well, kasi nga, yung melatonin, habang nagkakaedad tayo, yung gland natin na nagpo-produce niyan is hindi na ganun kadami na po-produce niya. Kaya nga umiikli ang kanilang pagtulog. No? So, you can give, just don't, not to exceed beyond 5 milligrams. It's not gonna cause any problem. No? So, may mga different formulations niyan. 1 milligrams, 2 milligrams, 3 milligrams. No? You can give that. Tsaka ang melatonin is not a sleeping pill. It's actually a hormone, no? So you don't take that an hour before your sleep, or a few minutes before your sleep or during your bedtime. That is actually taken 3 hours to 4 hours before your desired bedtime. Okay? Because yung peak absorption yan will happen within 4 hours, no? Yung peak action niya pala, so that it will be able to help in for you to be able to initiate sleep, and at the same time for you to be able to maintain and be able to achieve the 4 stages of our sleep. No, that's the melatonin. Okay, you can also try giving her some adaptogens coming from herbs and botanicals, like for example chamomile, or passion flower. These are adaptogens that will help produce those 3 hormones or those 3 chemicals na pinakita ko sa iyo kanina, yung melatonin, adenosine, at saka yung cortisol, no? So, kasi kung may imbalances dun sa tatlo na yon, that is actually affecting the quality and depthness of her sleep, no? So, ang problem kasi kung nakakatulog lang siya ngayon ng 3 hours, 4 hours, no? She's not going to be able to produce enough melatonin, okay? And that will definitely affect later on. In fact, melatonin has some anti-cancer properties as well, no? So, pagka bumaba yan at hindi na talaga napoproduce, dahil napoproduce lang natin yan sa gabi lang talaga, no? Sa dilim at saka sa gabi, no? So, then you can support it naman, no? Yung gland kasi napoproduce niyan, as we age, humihina na talaga yung production, no? If you want to be sure about it, no? You can actually measure melatonin level, no? In your blood, in your saliva, no? So, kung mababa na talaga yung melatonin, then more reason for you to give her the melatonin supplementation.
Thank you, Doc. Thank you for your information po. Thank you for sharing our time din po. Thank you po.
You're welcome. Sige, thank you. Stay safe and well there in Ireland.
Yes. I'm trying my best.
I have a friend there. I have a nurse friend there, si Jesse Raga. I know he's there. He used to work in Medical City. He's there in Ireland. I forgot lang kung anong hospital.
Okay. In Dublin po ba?
Yes, in Dublin, yes.
I'm working kasi on a county-based and COVID, kami receiving hospital in Louth. So,
I don't know where Jesse is
may
right now,
direct...
but si Jesse Raga is his name. He used to work in Medical City ER when I was still the head of the Medical City Emergency Room noon. So he was one of my
okay.
nurses, and he migrated there sa Dublin, Ireland.
Wow.
Sige.
Solid. Thank you,
Okay.
Doc.
So thank you. Any more questions po? Ma'am Jackie? Ma'am Helen? Any more questions? Meron pa po bang tanong? So before I go to my next webinar po. Any more questions?
Yes, Doc. Can I ask
Wala na po. Naka-off yung
Meron, Doc.
Yes?
Doc, si Tess Wu. Meron siyang question. Miss Tess,
Okay.
go ahead.
Sige po.
Naghihintay po kasi ako ng announcement, pero tatanong ko na din po. Kapag gusto ko po magpa-measure ng nutrient level, saan po kayo pwedeng makita after this lockdown po?
While during the lockdown?
After po siya.
After. Okay. Well, you can go to Medical City. They offer that test, or if you're in Makati, Makati Med offer that test as well. You just tell them that you want to measure your nutrient, micronutrient and macronutrient levels. No? Or if you are within Pasig area, you can go straight to the laboratory who owns the technology, yung Metametrics Laboratory po. No? Metametrics Laboratory. You just Google them, and then andun yung kanilang contact address, contact details, and you can schedule po. No? They also do, I think, home service. No? They also do home service. But if you have the time to go to the hospital later on, pagka okay na, pag safe na yung Medical City, Makati Med, I know Manila Doctors Hospital also is offering it. Which hospitals pa? Asian Hospital, I think, offers it as well po. And Asian, Makati Med, St. Luke's, no? St. Luke's, I think they have it as well po. Or even Cardinal Santos, they can offer micronutrient and macronutrient testings po. No? But if you want to go straight to the lab, yung Metametrics Laboratory is the one who owns that technology po.
Sige po, Doc. Thank you.
Okay.
Thank you po.
You're welcome. So, any more questions po?
Doc, I have one last question. Right now, I'm taking Calmag Zinc. Okay. I also take this, continue taking magnesium.
Who gave that to you po?
Ako lang sa healthy.
The only difference is that chelated magnesium is easier to be absorbed, no? So not unless you have evidence that you really require a higher dose of magnesium, but the Calmag D is perfectly fine na po yan, no? So that's okay. But unless you have, for example, are you hypertensive, especially if you are taking a lot of antihypertensive medications, no? Some of these antihypertensive medications and anti-diabetic medications are also depleting you of all of these micronutrients then. So then it's okay if you're going to take as well the chelated magnesium po, no? But still, the best way for you to gauge talaga how much your system needs, Ma'am Jackie, is to measure it po. No? So the difference lang naman ng chelated is that it's higher dose po siya, and then when you say chelated, meaning to say this is bioidentical po. No? So the bioavailability and the absorbability that it will be allowed entry by our cell is higher, is mas malaki po. No? Kasi hindi ibig sabihin na nagtitake kayo niyan, kung hindi naman ho pinapapasok ng inyong cell wall, baliwala po yan. No? So that's why I don't advocate using synthetic formulation. Okay? I would prefer plant-based sources and bioidentical type of micronutrients if you really need to take it po. Okay? So kasi para papasukin sila ng cell. No? So kasi wala ho silang saysay sa blood. Ang saysay nila ay sa loob ng cell. Okay? So, yun po yun. So, any more questions po?
Doc, pwede?
Yes po.
Doc?
Yes, ma'am.
Oh, okay.
Ma'am Helen.
Kasi,
yes.
katanungan lang ho ng asawa ko.
Yes
Kulang
po.
po kasi may insurance.
Mahihain si sir. Ayaw magtanong. Sige po. Kayo na lang po ang spokesperson.
Medyo kulang pa yung insurance kaya kailangan alagaan.
Okay.
And then, joke. Kasi he's diabetic. And
Opo.
then his recent blood work revealed that he lacks vitamin D.
Okay.
Uh, the doctor is prescribing him vitamin D, but he did not tell him how much, how often, but sinabi niya, kulang ka ng vitamin D and that's it. Hindi niya alam ano yung kasi you mentioned about vitamin D3, vitamin, there are two kinds of vitamin D. So
Correct.
which vitamin D does he have to take that will also harmonize with his diabetic pills, his diabetic medication.
Lahat ng sinabi niyo, reason talaga for him to be on vitamin D3. No? Vitamin D3 po is the type of vitamin D that is similar to the vitamin D3, the vitamin D that we get from the sun. No? Vitamin
Okay.
D3 for a diabetic patient, it has an insulin enhancing effect. No? Insulin enhancing
Vitamin
effect. No?
D3.
Kung hindi po sinabi ng doktor kung ilan, ano po yung current vitamin D3 na sinukat sa kanya na nagsabi ng kaya sinabi ng doktor na deficient po siya. Ano yung level po? Alam niyo po ba?
Ay, hindi ko
Oo.
na natanong.
Kasi if
Doc.
it's below 30 or below 20 lalo na, then he should be on at least 5,000 IU per day po. No?
Wow.
So if it's below 20, lalo na below 30 or below, lalo na kung below 20, maintain him on 5,000 IU. Na
5,000 IU.
IU po hindi milligrams. Iba po yung IU sa milligrams ha. 5,000 IU. Hindi ko na po alam kung paano compute yun, convert into milligrams kasi. But 5,000 IU can be maintained if his latest vitamin D3 level on the blood is between 20 to 30. No? So, as I've said, as a diabetic, he also needs vitamin D3 because it has an insulin enhancing response po. No? So, it will help in controlling his blood sugar level because his insulin will be more sensitive, no, to be able to bring in the glucose from the blood into the cell. Okay, so yun po. So more reason for him to be on vitamin D3.
Okay, thank you, Doc. Thank you very
Yes po.
much.
You're welcome po. So, any more questions? Wala na po. So if you have questions, you can ask Gab. I can share some of the slides, lalo na yung mga listahan po. We'll give it to Gab. Ma'am Tess, just coordinate with Gab po. I'll just have to prepare for my next webinar. But if you have questions, you can ask Gab for details on how you, or kaya ipasa nyo kay Gab po, yung aming pong head ng aming marketing. So para ho, masagot namin ang inyong tanong. Or you can visit our website, yung www.gotohealth.ph, or if you're a fan of our GMA TV show, yung Pinoy MD, no? So you can go to our website also, yung FB page ng Pinoy MD. You can I answer questions there also, no? So this is our own little way to be able to contribute and help out in this pandemic, no? By answering questions coming from those people who are not infected and who are locked down in their houses. Wag na po kayong pumunta sa inyong mga doktor sa ospital. Just ibato nyo na lang sa amin yung mga questions po, no? If we can answer it, we will answer it. If we know that you need to go to the hospital, we'll be advising you naman talaga, no? So, but stay away from hospitals as much as you can. So, for your benefit, you don't get infected. At the same time, you get to help our frontliners po. Thank you po for your time. Thank you for the opportunity that I can share with you my practice, no? The approach that I do towards health. And I hope all of you will remain healthy, safe, and stay well po. No, stay well. We have 2 more weeks to go. 2 more weeks pa. So, if you want a part 2, you just tell Gab po. I will be happy to and tell me kung anong gusto nyong topic po. Food as medicine, exercise, or hormone balancing, it's up to you po. Kung hypertension, you want to focus on that, it's up to you po. You just tell me lang po so that I can prepare my presentation po for you. Okay?
much, Doctor,
Yes.
for an enlightening afternoon.
Salamat din po. Okay. So do your self-care now po. Do your self-care. Sige po. God bless everyone po.